You're welcome to the Policy Council. My name is Opeyemi Agbaje. Today we talk about Ebola, defeating Ebola. I have a team of experts and policy leaders with me today in the program to discuss the issue. Well, I wouldn't say enjoy the program, but learn from the program. You're welcome back to the Policy Council. Today we have serious business, something called Ebola virus disease that threatens the whole of West Africa, including Nigeria. I have the leadership of the health sector in Lagos State here to discuss what we can do about Ebola, what is Ebola, and how we can solve the problem of Ebola. In a way, how do we defeat Ebola? I have the Honorable Commissioner for Special Duties, Dr. Wale Ahmed. You're welcome to the Policy Council.
Good morning.
The Special Advisor to the Governor on Public Health, Dr. Yewande Adesina.
Good morning.
And of course, the second-time guest on the Policy Council, the Honorable Commissioner for Health, Dr. Olajide Idris. You're all welcome. Let me start with my old guest, Dr. Idris. So what is Ebola?
Well, Ebola is a viral disease. That is a disease caused by a virus. Initially, I think the first appearance of Ebola was through some animals. Say the reservoir is fruit bats. And of course, literature has put it that you've got in chimpanzees, monkeys, and all. But it's always occurred in some West African countries, Guinea, all those places where you have
DRC.
In DRC. A human being can only contract it. I think the first case came through the animal. Then you have human-to-human contact. The contact between humans is basically through the secretions of an infected person, body secretions. So that's the only way it can be transferred from man to human.
So when we say body secretions, like sweat,
urine, blood, vomiters, semen, even breast milk, and the sweat. What it does is that it presents like a normal disease that we have here, like malaria, fever, body aches. But once you start getting to the issue of vomiting, diarrhea, then you have bloody stools. And basically what it does is it replicates, multiplies in your bloodstream. Breaks down blood vessels and blood starts seeping. You start losing fluid inside you. And that's basically what actually kills, because then the body goes into shock. If it's not properly supported, and it can have various damages to your organs. And that's why it's called hemorrhagic. We've heard hemorrhagic fever because hemorrhagic fever. That's what Ebola is.
Let's discuss that popular case of the first infection into Nigeria, what you call the index case, I gather. Now, how come, in spite of knowing that there was Ebola in West Africa and all of that, do you think we had the precautions in place to prevent that infection? But more importantly, do we now have measures in place to prevent new introduction from outside Nigeria into the country?
Lagos State has a disaster management plan right from years ago. We have a disaster plan in place, regardless of what type of disaster. And the Ministry of Health has an outbreak disaster plan in place, which we used during the SARS outbreak, which successfully contained that outbreak as well. So yes, we had plans in place to handle any kind of outbreak that may invade the state. We have upgraded our plans because Ebola is not just any other virus. When the threat started moving out of the country, the original country, and it started hopping around, way back as February and March, we had trained our doctors. We had done all our in-house plans, being ready. We had given out literature. We were ready since March. What do we do from here on? Because it's here and we now know its characteristics, we know how it behaves. This is an urban outbreak as opposed to the rural outbreak that our partners have been used to. It's a new experience for everybody because they've never been in such a densely populated area with an outbreak. So we've scaled up on our plan, and I know for a fact that with the Ebola Emergency Operation Center that has been set up, with all federal government, Lagos State, WHO, CDC, MSF, and the other partners that are involved. There is a template being developed for the whole country where if an outbreak happens anywhere else, there's something there already to kick into gear and get the place secured.
If somebody today is in Lagos or anywhere in Nigeria senses that he has these symptoms Dr. Idris described, what should he do?
If it is that person, out of the public enlightenment we have been carrying out, and suspects by himself that he probably has something reminiscent of, the symptoms he had been hearing about, the thing to do is to, first of all, help other people by
removing himself.
Yes, by staying away from others, and get in touch with our 0800 Ebola help.
0800
Ebola help. There are people there on a 24-hour basis that will pick that call, get the location. There are people who have been trained to dress properly so that they will not infect themselves while they go pick that person.
So they immediately evacuate that person?
Yes, but if it's a doctor or other health worker or in a hospital setting that the doctor suspects, or anybody, even at home, suspects, what they should do is to stay away. Naturally, Lagosians, Nigerians generally,
even every mother, they naturally think, or a husband or a wife.
Exactly, we naturally want to move closer and help. Ebola is different. In this case, at least for now, until we give an all clear sign, what we should do if we suspect is to stay away and call that line, 0800 Ebola help. If it's a doctor, if he doesn't have the facility, generally in hospitals these days, people should practice barrier nursing.
What is this barrier nursing?
It's a technical thing. It just means that throughout your interaction with a patient, you are not in contact directly with the skin and other body parts.
Unfortunately, sadly, we lost Dr. Adadevo and one or two other people. It's because at that point, they were not practicing barrier.
At that point, they did not know what it was. The presentation of Ebola initially can mimic the common fevers we have here. Malaria, typhoid, and all that. Sustained fever does not necessarily mean Ebola. I mean, back then. But if you have sustained fever now, you want to consider Ebola first before thinking it is any other kind of fever.
Let's take a short time out and we'll continue on this direction. We'll be right back. You're welcome back. It's still the Policy Council, and we're talking defeating Ebola. And I have Dr. Jide Idris, Commissioner for Health, Dr. Yewande Additional, and Dr. Wale Ahmed. 3 doctors, all united to defeat Ebola. Dr. Idris, I know that this is clearly a multi-tier effort. There are federal, she mentioned all sorts of agencies. What are their roles and what are they doing?
Basically, like she said, you have the Emergency Operations Center. It's that center that coordinates all activities of this control issues. And this is structured in a way that you have different units. There's a unit called the Contact Tracing and Surveillance, which is very, very essential because that unit actually sends out to different parts where every single contact that have been made by any of those cases confirmed have to be traced, line listed, and followed up till the time to start. That's contact tracing. Once you get a contact, once they get a contact, they follow up. As soon as the contact develops fever, they move the contact out into the isolation ward. Then the case management team, which is the next unit, takes on. The case management basically manages all these cases, whether suspected and confirmed. Suspected, but with symptoms, you go to isolation ward. They now follow you up. Once they take your blood and it's positive, you become a confirmed case. Then they start giving you supportive treatment. The third unit is what they call the port of entry, which is very, very essential. If you remember, soya came in from Liberia. That's the index case. It was introduced into Nigeria. And that's why the borders are very, very essential, the land borders, the airports, and the seaports.
The seaports.
Now, the essence is that to prevent any entry of any possible case from other West African countries, and that's very, very crucial. What we're dealing with now is that index case. If you have another
Every
case,
single case we know came from
it's traceable to this first case. We hope that we don't get another case. That's one. So the fourth one is the public enlightenment, advocacy, which is essential. That's where everybody goes around educating people, sensitizing people what Ebola is, how it presents, what they should do. Very, very essential. The last one has to do with data. You collect all these data from the field. Everybody they analyzes and tells you at the end of the day that this committee meets morning and evening every day.
Okay. Let me ask, Doctor, you mentioned the public enlightenment and public health dimensions of this. So, Dr. Additional, there are lots of myth and panic and fear and everything about Ebola. So some people have been eating bitter cola. Some people have been drinking salt and water and bathing in salt and water. And of course, all of us are using sanitizers. Give us, to enlighten the public, all of these issues. What's your take on them? What is real? What is myth? What should we do?
It's not so much of what my take is as much as what are the facts. The facts are hand washing is the best precaution.
Soap and water.
Soap and water, hand washing. Hand sanitizers are okay if you don't have access to soap and water, but they do not substitute soap and water. The first opportunity you have to wash your hands in soap and water, you take that opportunity and wash your hands frequently. We didn't have to have Ebola hit us before we start to use soap and water as part of our routine personal hygiene. And I'm hoping this stays because it's something we needed to have been doing long before now.
Okay.
Bitter cola has no basis. There's no medical, clinical research support for bitter cola. Salt water, I believe, is out of ignorance because sodium hypochlorite, which is the bleach solution, was easily confused for sodium hypochlorite, which is salt. So that needs to be corrected. I'm sure a handful of people now have hypertension, compliments of drinking salt water. The other issue that was going around is handshaking or hugging. There's a new Ebola greeting in town. And that is an exaggerated reaction.
Okay.
I think we should be afraid, but it should be a healthy kind of fear. The kind of fear that allows us to take proactive measures, not the panicky
ones.
Kind of fear that puts everything in disarray and people are sending text messages. The social media goes crazy with all kinds of untruths about Ebola is in a place, avoid it. Ebola is in this place, avoid it. We don't need that. Bushmeat. Should we eat bushmeat? That was another thing I hear the Bushmeat Association.
I saw them in the newspapers.
And we need to understand that Ebola is not indigenous to our culture. It is not in our wild animals. We don't have the fruit bats. It's indigenous to other West African countries, especially Liberia, Sierra Leone, Guinea, the Republic of Congo. And they're not like our domesticated bats. They are actually wild animals. So getting worried, we get tests, go and wipe out all the bats in the environment. There's an ecosystem. There's something those bats are doing to help us balance our system. Bushmeat issue. We have been told that the eating of the bushmeat is actually not how you can get Ebola. It's in the preparation of it where you come into contact with its body fluids, with its blood. Again, just being the devil's advocate, maybe the bushmeat was not well prepared and you have a raw or fresh area in it. Yes, you can get in trouble with that. But we know Ebola dies at a temperature higher than 60 degrees Celsius. So if you cook your food really well, you should not be afraid to eat anything that comes on your table.
Okay.
Handshake. We have to understand that the person with the infection is only, capital letter, underscore, bold, only infectious when they are symptomatic. They will carry the virus, yes, because they've been exposed, but they do not disseminate or infect other people until they develop the fever, nausea, vomiting, diarrhea, and all the other symptoms that the Honorable Commissioner had mentioned. So you will not find an Ebola infected person at a party where you need to now do handshake. You won't find them in the market. They are too sick to come out and socialize. So maybe that is some comfort for people.
A friend of mine said his wife came in from UK a few days back and wouldn't even hug him. Let's take a short time out and we'll be right back. You're welcome back. It's still the Policy Council and we're talking about how Lagos and Nigeria can defeat Ebola. I have the leadership of the health sector in Lagos with me and we're having an enlightening conversation. So Dr. Ahmed, let me ask you, there's a lot of conspiracy theory around soya. And I've read some of the accounts. The word is inexplicable. I can't explain its behavior. From the benefit of your insight and knowledge, what was his motive in coming to Nigeria?
Well, I'll start by saying may Soya's soul rest in peace.
Many Nigerians will not say amen.
I said, extremely body and kill him again.
Africans, when somebody passed on, we pray for the repose of his soul. Since he is not around to tell us the facts of the case, the truth of the matter, I will just take all the things we have been hearing and reading about, as a matter of conjecture. We have had all sorts of things. The important thing here is that it came to us, and we are going to defeat it. We have been taking all the right steps, and there are protocols, strict protocols, and we are following them. Whatever motive was, that is belated now, really. And on the issue of bushmeat, the way I would like to put it is that, yes, it is when you have not cooked very well. Yes, it is not indigenous to us. But come, we have chicken, we have snake, we have ram, we have goat.
So there are many alternatives for now.
So yes,
the problem is there are some people whose economy is precisely.
There are some people whose delicacy.
So for economic implications.
For now,
you will exercise caution.
I believe very strongly that we are defeating this disease in a very, very short period. So all the caution we can exercise for now. I think we should.
Let me ask Dr. Idris about Zimap and other drugs.
Nano-silver.
And nano-silver. The two Americans, the two doctors, the US citizens have recovered. And we're not in a position to say scientifically, I'm sure you would note, whether it was Zimap that cured them or not, but it didn't hurt. It probably helped. Why can't Nigerians? What is the US saying? What reason are they giving for not giving us Zimap?
Zimap is an experimental drug. It's just undergoing the research protocol. They have different stages of tests. The only stage they've done is animal testing. What WHO has done is that because of the situation we have ourselves now, they've kind of given a rapid approval to testing. Go back to the American. What they used was the serum. Just a little bit they had in their thing, and they did it as a last resort to test, just to see what will happen, and it worked. They don't have enough.
Okay.
They have very little from what they say, and of course that's why they can't bring it here. Now, for Zimap, we've made contacts with the manufacturers. We have about 8 manufacturers different, but Zimap is one of them. The other one with Canadian is Tecmira, TMK. And when we made contact, the fact is that you have a long line of people who have made orders. They have shortage. And that's what we are trying as a Lagos State, that is that, see how fast we can. That's the situation now. Okay. On nano-silver, the controversy, it's been killed. Nano-silver, as far as we are concerned, is not a drug. Okay. It's a supplement, just like ginseng or whatever it is. And again, it has a pesticidal activity, so it's not a drug. We are not using it. Okay. And luckily, the Minister for Health, Federal Minister for Health, has said that the research control unit has said no to it. So that's the issue. The opportunity for us again, if you remember, we discharged some patients. Yeah. I think further on, those are cases they might use to check, develop serum, and maybe if it's properly done. But again, those are the things that will be done further on. So those are the issues.
Okay, excellent. Let's take our final time out. We're enlightening the public and ourselves about Ebola. And like Dr. Adeshina said, this is not a time to panic. It's a time for rational, calm, enlightened action. We'll be right back. You're welcome back. It's my final segment on this program dedicated to defeating Ebola. Now, let's talk about some of the specifics that I have been worried about and some Nigerians have been worrying about. So, for instance, resumption of schools. There are some cases we've heard that people have deferred resumption of schools. Should we do that? What's your opinion on that?
Well, that decision is a federal decision that applies to every state in the country. Okay. It's a prudent decision. Okay. We are still looking at this Ebola virus in an urban setting. Okay. Like I said, it's a new experience for everybody, even the experts in the international community. The Ebola Emergency Operations Center, the committee that has both international and even local, the Association of Public Health Physicians are involved, the Association of Private Practitioners are involved, a lot of other local chapters are also involved, need to look at how our schooling system is working, and that is currently going on. There is going to be a standards of operations and procedure for all schools on how to have the students resume.
Let me ask you, Dr. Ahmed, about public transportation. That one we can't defer. So today, people are in BRT buses, other types of public transportation. What should we do?
We have to live our lives as normally as possible, the way we have been doing. There is nothing wrong with getting on the bus, and sitting beside anybody. In the first place, somebody
who is in the bus,
who is in a position to infect other people, and
it's not likely to be in the bus.
He's not going to be on the bus. He's going to be prostrate. He's going to be so visibly sick. They are going to have to. When Sawyer got to the airport, he was prostrate. He couldn't walk. They had to carry him. So people should go on the bus. People should live their lives. It's just that we should be careful about certain things. So that is not a problem at all. Okay. Fortunately.
Let me ask you, sir. Other public assemblies, churches, and I know there's been a lot of worry about that. I know some people who didn't go to church last Sunday because of Ebola. Churches, markets, restaurants. I have clients, corporates who are experiencing problems in their restaurants. Yeah. What do you say?
Well, basically, look at emergencies generally, whether it's Ebola or whatever it is. There are situations where we have large gatherings of people, and you have to take specific precautions because that's when you have the greatest number of injuries or casualties. So it's the same thing with Ebola. Ebola, in the sense that, it's a catch-22, situation. If you say don't gather, yet you may not be able to trace whoever is a suspected case or something like that, so they go into hiding. So if you say gather, if you are a case, you won't be in such gatherings, you'll be on a hospital bed. So, but it's a situation where you have to use public enlightenment. You have a lot of people that can pass on information from. They can tell them what precautions to take. So we say yes, avoid it, but if you need to do it, take specific precautions. Because I'll give you the example of the RCG, Redeemed Christian Church, and then the synagogue. There were text messages fear that these people are organizing conventions specifically for Ebola. And we had to move quickly. And luckily, the two of them had different stages of preparation. They too were aware. They set up structures to enlighten their people. They even developed their pamphlets. I tried for redeemed. So all we needed to do was support them and give them the additional information that they would know what to do. So large gatherings, yes, there are situations for mass casualty, but again, with another situation for public enlightenment. So we will say, if you don't necessarily need to be there, don't go.
I dedicate this program to Dr. Dadebo and Justina Ejelonu, who we've lost, and the others that we've lost to this. What should health workers do?
Health workers don't need to panic. We've heard about doctors turning away patients, don't even want to hear about a patient coming in with fever. And it's unfortunate because part of the Hippocratic Oath is first do no harm. When you turn someone away with fever, God forbid that person has Ebola, you have endangered yourself, you've endangered that person's life, and you've endangered the community at large. We are taught as medical professional, like Dr. Ahmed said, barrier nursing, international precaution, control. Your white coat is not just to make you look like a doctor. There's a reason doctors wear long sleeve white coats, buttoned down, is to protect you. You wear your gloves. So we have a process, we actually, the EOC actually developed standards of procedure for all our healthcare facilities, private and public, on how to handle anyone with suspicion for Ebola. Your gloves are very critical. Double glove, as even triple glove if you want.
If you want, yeah.
But don't turn the patient away.
The message from the leadership of the Lagos State Health Sector is be calm, take enlightened precautions, but don't panic and don't cause panic. I'll give the final word today to Dr. Olajide Idris, who was a classmate of the late Dr. Adadebo.
Well, I think we should give tribute to Dr. Adadebo and the other medical workers of the first consultants who were direct contacts of Mr. Sawyer. Without them, we don't know whether the situation in this country would have been worse than this. To me, they did a fantastic job. They have saved this country from a horrible situation, and we should give them all the honors that they deserve. Dr. Adadebo, in particular, I was told, was not even on duty, and she was called because they had this seriously ill patient, and he left her house. She dedicated herself, including all the other workers, to treat this patient, and in the course of doing that, they caught this disease, and some of them died. We need to pay glowing tribute to them. They were heroes and heroines of Nigeria on this case, and may the good Lord grant their soul eternal peace.
We'll be right back. The message is Ebola is not necessarily a death sentence, and neither is it mandatorily a mass epidemic. We can defeat Ebola. The message is be calm, take enlightened precautions, be prudent in your decisions and choices, and exercise basic principles of public hygiene. With our support and with the cooperation of all Nigerians and with the efforts of the Lagos and federal governments and all the other states of the Federation, I'm persuaded that Ebola will be defeated. See you next time.